Hi guys, welcome back. We shall be talking about how can you find out that you are actually damaging your kidneys and how can you stop a patient or anyone who is going to the road of kidney failure. Now this kidney failure is very important that we find out in the first place, that means in the earliest stages, so that we can help in the best possible way, because once you damage your kidney to a very great extent, there are only two options in order to survive. Either you do your dialysis or either you do your kidney transplant. Now this dialysis is expensive, painful, have to be done regularly, will take your productivity life, will take a very good task on your family life, social life. Along with this, if you do for your transplant, it is very expensive. Along with this, you need to get a very good donor. It has to be legal. Again, along with this, you have to do lifetime, you have to be on lifetime education on immune suppression drugs. Now if you're taking immune suppression drugs, again it puts a risk of another substances like opportunistic infection. That means if your immune system is not working the optimal level, your other infection can come and infect you. Talking about this context, about in this time is your coronavirus pandemic. Now if your immune system is not working to optimal level, you are having higher chances of developing the side effect or the complication of coronavirus. So that is the reason we don't want you to actually go and have the kidney failure. So that is the reason we are supposedly trying to find out the initial test to find out that you're going to have your kidney damage in the later stage of your life. What are the tests? Before the test, we'll try to study why do you damage your kidney in the first place. There are multiple number of reasons. Out of that, there are main two reasons. The main two reasons of your kidney damage is uncontrolled diabetes mellitus and uncontrolled hypertension. I repeat, uncontrolled diabetes mellitus and uncontrolled hypertension is the main two culprit to damage your kidneys. You have to have a very strict control of your diabetes, your blood sugar, and a very good control of your high blood pressure. Okay, how much do you want you to control your blood pressure? We want to control it by 140 by 90, but ideally we want to make it 120 by 80. Okay, and blood sugar also has to be in the normal range. We want that to come in the normal range. Along with this, other things that is going to damage your kidney is high sodium intake. If you're taking sodium high, you are going to retain more water, more amount of water. That means more dilution of blood. More dilution of blood means blood has increased in volume. More amount of volume means more amount of blood pressure that you don't want. Now, how much sodium is safe in one day? 2300 milligram is safe in one day. Ideally, target for 1500 milligrams per day sodium. Please do not worry about the sodium that comes from your kitchen. Be more worried about the sodium that is coming from your fast food, your packaged food, and your restaurants. Along with this, if you're taking some sort of herbal medication, now this herbal medication can actually damage your kidneys, because you never know what is been mixed on those herbal medication. There is no authentic body that is regulating it. You don't know what is the ingredient, and some of these herbal medication are very deadly as well, because they contain high amount of painkiller, high amount of antibiotics, high amount of steroids. You never know it. So whenever you use your herbal medication, be cautious about this. Along with this, if you're taking very less amount of water, whenever you're taking less amount of water, your filtration is been reduced, because if there is no water, there is no filtration taking place, and there is high chance of stone formation. Once you have stone formation, it actually damages your kidney. Along with this, if you're taking a lot of alcohol, whenever you're taking a lot of alcohol, your your uric acid increases. Whenever your uric acid increases, you will be having joint pain and all that. Along with this, you will be urinating a lot. That means you will be dehydrating a lot. Along with this, if you're using unjudicious use of painkillers and antibiotics, if you're using unjudicious use of antibiotics and painkiller, you're actually going to damage your kidneys. Along with this, if you're taking a lot of stress, you are going to increase your blood pressure, and in the meanwhile you're going to damage your kidneys. With this, if you're not emptying your bladder regularly and not emptying your bladder completely, this is also a very important reason that you might damage your kidneys, because if you're having retention of urine in your bladder, this urine can go and ascend up to your kidneys and it can infect your kidneys. Now this is known as acute pyelonephritis. There was a study which was found that the medical nurses, because of their work profession, their urinary bladder has increased in their size, so that is putting them in risk. So please try to understand them and respect them for this. They are taking care of you. In the meanwhile, they're damaging themselves. They're valuing you in a more manner than themselves. So we should respect them. So thank you to all the nurses. And now we're talking about the test. What are the tests that you're supposed to do if you are suspecting that you're having kidney disorders? Now, before I start, you should understand that kidney and liver are this kind of organs that they are not going to give you any kind of symptoms. That means, to give you a context, if your kidney, you're having two kidneys, one kidney is damaged 100%, the another kidney is damaged 20%, no symptoms, 50%, no symptoms, 75%, no symptoms. Once it crosses 75%, then only you are going to see the symptoms. So if you're waiting for the symptoms for your kidney damage, you have already damaged your kidney to a great extent. So you should never wait to see for the symptoms. And kidneys and liver will not show you any symptoms unless a huge chunk of it has been damaged. Now, what are the tests that you're going to do? You are going to do kidney function test. Now, in this, you are going to do serum creatinine level. There are other tests as well, but the main one is serum creatinine level. This serum creatinine level is estimated by taking blood, taking your blood, and we are trying to see how much amount of creatinine is present in your blood. This gives a very good indicator how well is your kidney functioning. Along with this, we will find out the GFR. That is the value. This shows that how fast is your kidney able to filter out the toxins. Right? How do you do it? I'll put a link on the description. You can check it out. You put your serum creatinine value, you put your age, you put your ethnicity, you put your weight. It will tell you the value. Now, if your GFR value comes 90 or more than 90, your kidney is functioning perfectly fine. Now, if your value comes 60 to 89, there is mild damage to your kidneys. That is, your GFR is 60 to 89, there is mild damage to your kidneys. Now, if your value comes from 30 to 59 days, moderate damage to your kidneys. Now, if your value comes from 15 to 29, there is more severe damage to your kidneys. Now, if your value comes less than 15, this is end-stage renal disease, or it is in this stage you might be requiring a kidney transplant, or you might be requiring a dialysis. So, GFR is very important. How do you find out? By the use of the calculator. And the serum creatinine level value also gives a very good indicator. Along with this, you need to check your urine. In urine, you are going to see for the albumin concentration, the albumin level in your urine. Divide that value by the creatinine level that is found in your urine. If you find out that value that you are going to match with the reference value, it will tell you how well is your kidney working. Remember, this creatinine is found in your blood also. We are taking the account in the calculation of creatinine from the blood creatinine as well as the creatinine that is found in the urine. Both the calculators are placed in the link in the description. Please check it out. These are the only two ways that you can find out that your kidney is actually working perfectly. Now, there's one thing that is very important. If you are male, generally your creatinine level is a bit higher as compared to females because of more amount of muscle. If you're doing a lot of exercises, you are having a good amount of muscle mass in your body, your creatinine level will be a bit more. Along with this, if you are having fever, even your creatinine level will go up. So does it mean that you are having kidney damage? No. If these values are altered for around 3 months or more than 3 months, then only you will say that you are having some issue with your kidneys. Right now, once you know that you are having some issue with your kidney, what is the next step that you are going to do? The next step you are going to do is to go and meet your nephrologist. You have to go and meet your nephrologist. Along with this, cut down your salt. Maintain a very strict your blood sugar level, very strict your blood pressure level. Reduce your stress, manage your stress, reduce your alcohol. With this, increase your water intake. Along with this, urinate properly, empty your bladder completely and regularly. Along with this, do not smoke. And yes, in some cases, in young adults also we see kidney damage. Is it due to age? No. In those cases, the common reasons are due to some sort of infection and due to some sort of autoimmune disorders. That means your body is actually damaging kidney itself, or due to some sort of infection. So please watch out for your serum creatinine your albumin in your urine and the creatinine in your urine. Use the calculator and find the value, find out the GFR. Any alteration around for 3 months or more than 3 months, go and meet a nephrologist soon. Do not wait for the symptoms. There will be no symptoms, because kidney and liver will give you symptoms whenever your kidney and liver has damage to a very great extent. Now yes, overall, if you want to know that your urine, kidney are damaged, is there any symptoms? Yes, there can be some symptoms. Now those symptoms will be your urgency of the urination will be increased, your frequency will be changed. Either your frequency is increased or your frequency is reduced. You will be having burning maturation. There is chance that you will be having burning maturation. It means that you are having some infection, and this infection causes damage to your kidneys. Along with this, you will be tired. Why you will be tired? Because kidneys are responsible for production of RBC. RBC is responsible for production of this thing, hematopoiesis. This means your kidneys are responsible for production of hematopoiesis. That means your oxygen reduction will be there. That means you'll be tired all the time. You will be having anemia. Along with this, your you'll be tired even if you press your over your kidney area. You'll be having tenderness. Along with this, you might be having fever. If you see your urine, it might be discolor, might be altered. It might be like cloudy color. You might see your blood. Along with that, your urine might smell very bad, and there may be a lot of foam production. Whenever there is a lot of foam, it means there is protein, and whenever, as I told you, protein coming out in your urine is pathological. It means your kidney is not functioning properly. So as I told you, please do not wait for the symptoms to watch out. The symptoms are not always very specific of kidney. Tiredness, there can be any reason. Anemia, there can be any reason. Fever, there can be any reason. The reasons are endless. Okay, so it's not going to pinpoint. So the main thing is that you have to do your creatinine value from your blood, creatinine value from your urine, albumin value from your urine. You have to calculate your GFR and the ratio of the albumin that is found in your urine divided by the creatinine value that is found in your urine. This two calculation will give you a very good idea about your kidney functioning. And do not wait for the symptoms. And as I told you, the causes that can actually put you in risk in developing kidney disorders is excessive use of painkillers, antibiotics, not urinating adequately, incomplete evacuation of the urine, and along with this a lot of infection and alcohol, stress, uncontrolled hypertension, very important. Uncontrolled diabetes, very important. And whenever you are having some sort of injury, or if you are taking some sort of excess amount of caffeine, and at the same time if you are taking some sort of herbal medication. Yes, herbal medication, as I told you, they sometimes contain some substances that are not supposed to be contained, or which are very aggressive. So this can actually damage your kidney. So whenever you have this alteration, around 3 months or more than 3 months, go and meet your nephrologist. Please do not avoid it, going to your nephrologist. Do not sit back at home and thinking, oh, I don't have any symptoms, that means I'm not having problems. As I told you, a very good amount of junk has to be damaged, then only you'll be able to see some symptoms. And go and meet your nephrologist, and they will be able to treat you in a very well manner. And that's all for now. Thank you for watching, and I'll see you around. Bye.